name is Dr. Ranchal. I'm a physiotherapist. I have completed my graduation from PGI Rohtak, and I have completed my post-graduation from England, from University of Central Lancashire. I have specialized in sports injury rehabilitation, and after that I have a couple of years of working experience with Preston Norton Football Club. Right now I'm working with Sarvodaya Hospital, and my specialization, as I told, is in sports injuries and sports injury rehabilitation. And currently I am also working with BCCI. I am a appointed physiotherapist for Jharkhand first class cricket team, and specialization is in sports. What I focus on the biomechanics of biomechanical analysis and kinesiology, right? So if you can say walking, we analyze the walking pattern of, and we analyze walking gait, running gait, any kind of all day living activities. If you have any injury, we analyze the motion, we will capture your motions, and we have applied some new technologies over here to analyze motion and kinesiology, so that we can accurately diagnose and create a perfect treatment plan, rehabilitation program according to needs of the patients. Right, talking about sports rehabilitation, what area we cover? The specific areas are, our target people are sports people who engage in sporting activities, get injured all the time, get something like low back aches, knee aches, ankle joint injuries, shoulder joint injuries. So what we do, we treat those sports specific injuries, like for say example, if athlete is a long distance runner, right? So the most common injury in long distance running is your shin pain. Every long distance runner must be having shin pain. So what we do, we analyze the biomechanics of his running, then we teach him, we treat him, we prepare a rehab protocol which will include the correction of his biomechanics. Other than that, sports like cricket, fast bowlers most often get injured, like knee injuries, ankle injuries, their low back injuries, shoulder injuries. Throwing players like 100 meters javelin throwers, shot put throwers, all discus throwers, they all have shoulder injuries, different kinds of shoulder injuries. So we work on that with sportsmen, so that we can know that what is their need, what they cannot avoid. So what we teach them the most efficient way to do those things, because we cannot restrict sportsmen to play their games. So our focus is on not restricting players to play their game, but finding a better way so that they can enhance their performance, reduce the chances of injuries, and most importantly, rehab after any kind of injury. There is a game of tennis as well. The most common injury, tennis elbow. Many patient comes up with they are having pain in elbow. That actually, tennis elbow, how it occurs? It occurs with a back shot. If you have wrong back shot technique, the tennis elbow is gonna occur. It is lateral epicondylitis actually. So it is not basically, specific only to tennis players. It can happen to normal people as well. Like in household, people used to carry heavy weights. Like females used to carry heavy buckets and other things, which can also lead to tennis elbow, that is lateral epicondylitis. We use the term tennis elbow because it is very common in tennis players. So for tennis elbow, we provide treatments, different rehab protocols, different exercise protocols. So we work on that as well. Right. Other injury, ACL reconstruction. The most ACL tear is the most common injury with footballers. It is a knee injury, and rehab sometimes provide many kind of restrictions, because there is a myth that if once you get injured, you will not be able to play that well that you are playing, that you was playing before injury. So In our treatment plan, what we include, just like if you get operated for ACL and you have just started your rehab, our treatment plan includes the joints. We are just not going to cover the knee joint. We are going to cover all the joints, the proximal joints and distal joint as well. The focus is going to be on pelvis stability. So we will be training core muscles. We will be training low pelvic muscles, low back muscles, abdominal muscles, so that your pelvis balance your legs very well. Once your pelvis is stabilized, that means you are not going to injure your knee anymore, because once you got a good foundation, you got a good base, then your knees are going to function very well and efficiently. So we will focus on pelvic stability. After that, we will come to the knee part. After that, we will start focusing on isometric exercises. These are the exercises which are done soon after the surgery. These are the basic exercises. So we're going to start with the isometric exercises for quadriceps, hamstring, low back, gluteus as well. So after 1 week, when you get good strength, when you get good control over your legs, when you start standing and good control over your body, then we start with kinetic exercises. First of all, we'll start with closed kinetic chain exercises, in which your distal part of your limb don't move. The only thing which is moving is the inside kinetic chain. After that, in the 3rd week protocol, we'll start with open kinetic chain exercises, and then plyometric exercise, and then sport specific exercises. So that's the way we break down the rehab protocol into so many parts, so that player gets the most out of it and returns to his sport specific areas.